who is. He now chairs the NHS Confederation, which represents NHS trusts. Welcome to the programme.
Thank you.
Are BMA militants spoiling for a fight, as the Secretary hints this morning, or has Jeremy Hunt just bungled the negotiations and provoked hard-working doctors to down their stethoscopes?
I think the last thing patients of the health service want is a kind of running commentary about the behaviour of the negotiating parties here. I think it's disappointing that we've got a strike action planned for this week, but what we need to see is the parties back in the negotiating room dealing with the detail that your programme, your report just highlighted. That can only be dealt with round a negotiating table.
But for the overwhelming majority of doctors to back an unprecedented action of strikes, including a full strike on the final of the third one, it hardly suggests that the negotiations have been handled with aplomb.
Well, I think what's been going on within the negotiating room is addressing the detail, and any pay negotiation, as you know very well, Andrew, covers a mass of very complex detail. There is a commitment, both from the BMA and from the employers and the government, to deliver better performance over the weekend than we've seen. We've seen in our hospitals that there is an issue around excess mortality. The government, I think, is right to address that issue. This is part of the response to that issue, and that's a commitment that is shared by all the negotiators.
Well, except they can't be that committee since they're going on strike, and the government's claim that there are 11,000 unnecessary weekend deaths because of poor weekend cover, that's just a propaganda figure, isn't it?
It's absolutely right that the excess mortality is not just around weekend cover. That's clearly true.
But the 11,000 figure is a propaganda. It's a propaganda figure.
No, there is analysis that shows that there is excess mortality in British hospitals at weekends. That is an issue that the BMA, the doctors, the clinical leaders of the health service and the management leaders of the health service and the government from a policy point of view all understand needs to be addressed.
Except the report which came up with the 11,000 figure said at the end it's not possible to determine the extent to which these excess deaths may be preventable, and said it would be rash and misleading to assume they were. Rash and misleading, and it's the figure the Secretary of State uses all the time. Yeah. Rash and misleading.
And I'm not using it. What I am saying is that there is a need to look seriously on behalf of patients at question if there is evidence, and there is evidence of excess mortality at weekends. You and I know.
We know there's excess mortality. The question is the 11,000 figure.
So what should we do? Should we simply sit back and do nothing about it?
But if we think the figure's not right, perhaps the Secretary of State shouldn't be using it. But let me ask you a broader question. Is it not wholly unrealistic to implement a full 7-day-a-week cover in the NHS without an increase in overall NHS resources?
Well, and that's, of course, what the government announced in the comprehensive spending review just before Christmas. What is unrealistic, Andrew?
But that, excuse me, Stephen, that is simply to keep the NHS ticking over. Yeah. It's not to pay for 7-day-a-week cover.
What I was going to go on to say is that it is unrealistic to imagine that we can deliver the kind of health and care services we want in our country without addressing some of the fundamental issues around budgets, you're quite right about that, but also about joining up the different elements of the health and social care system. Because, you see, we talk about the NHS budget, and then we come into the studio on a separate weekend to talk as though it's a completely different subject about the funding of social care and residential care and home care services. What we need to be more adult about is looking at this as a single system, which is why I and the NHS Confederation supported this week a call for a review of the funding and structure of health and care services on a cross-party basis.
Let's look at the funding, because the government is trying to implement a 7-day-a-week cover on health spending that is essentially unchanged in real terms, not financing that. And just look at what our health spending is. These are from the OECD. As a share of our GDP, look at among the wealthier countries of Europe down there, we spend 8.5% of our GDP on health. That includes private health. These other countries, Netherlands, Switzerland, Sweden, Germany, France, are all close to 11%. Given that we already spend less, how can we hope to have a 7-day-a-week NHS on 8.5% of GDP.
You talked about slogans earlier, Andrew. Can I just pick up this slogan, the 7-day-a-week NHS? Most of the people who work in the health service know perfectly well we already have a 7-day-a-week health service.
But the argument's about full cover. What do you say about this?
What I say about the funding of the health service is that that's precisely one of the issues that I agree does need to be addressed. It needs to be addressed, I think, on a cross-party basis. That's one of the things I learnt as chair of the cross-party health committee in the last parliament.
But can we afford things like 7-day-a-week full cover, which is what has been proposed, with that level of health spending, which only Ireland devotes less of its GDP than we do? Can we?
I accept that there is an issue around excess mortality in NHS hospitals at weekends. What I do not accept is that we don't have a 7-day-a-week health service.
No, but what I was asking you was, do you accept that we need to spend more we need to get closer to France and Germany than we are at the moment on spending?
I do agree that not just in this country, but right across the world, over a very long period, as societies get richer, they spend more of their income on health and care services. But we have to move away from thinking the health service is an island. It is part of a care system, and we need to look at that on a holistic basis across health and care, and that's why I think we need a cross-party review
Which is
to
what
look
you're
at
going
this in the medium and longer term.
You're doing your commission. I hope you'll keep us appraised of that as it goes on. Thank you, Stephen Dorrell.